Hello everyone and welcome back. So we are going to do or study the examinations of surgery specifically, and in this video we are going to discuss the steps of examination of a lump. So first of all, you have to say the greetings and tell your name that I am Dr. Dej. Then how are you? What is your name? You have to ask this from the patient, and then can I examine your swelling? Ask for the exposure of the area and call female attendant for the female patient and note the following points during inspection. First of all, you have to note about the site, that is, describe the exact site by measuring distance from bony mark and describe it in the anatomical terms. For example, there is a spherical swelling on the extensor surface of the right forearm 10 cm proximal to the wrist joint. So you have described the exact location of the swelling, that is, there is a spherical swelling on the extensor surface of the right forearm 10 cm proximal to the wrist joint. Then you have to notice the size of the swelling, the shape of the swelling, the Okay, so you have to note the symmetry of the swelling, the scar, and the number of swellings, the overlying skin, which is either smooth, rough, scaly, pigmented, etc. Then you have to ask for the cuff impulse if needed, and then ask for the swelling if it is in front of neck. Okay, so this was all the points on inspection. That you have to notice the site, then the size, the shape, the symmetry, the scar, the number of swellings, the overlying skill, then ask for the cuff impulse and ask for swelling if it is in front of the neck. Now note the following points on the palpation, that is, ask for pain before proceeding to palpation. Then check the temperature over it and compare it with the surrounding skin. Then check for the tenderness. Then measure the size, that is preferably with measuring tape. Then check for the surfaces, whether it is smooth or irregular. The edge, that is wall, are poor defined. Consistency, which is soft, firm or hard. Then fluctuations, then transillumination. Then pulsatility, which is expansile or transmitted. Then fixity with the skin, muscles, tendons and bones, and reducibility and compressibility, and perform the slip sign. So all these you have to done to all these steps you have to done in the palpation. Okay, now don't forget to examine the draining lymph nodes and check the neurovascular status of the area or a limb, and then ask for any other similar swelling at any other part of the body, and examine the whole body for any other swelling, whether similar or not. And never forget to perform general physical examination of the patient, since that gives an overview of the patient's health and can aid you in reaching the diagnosis. Okay, so all these points were done in the inspection. Palpation, sorry. We have done all these steps in the palpation. Now coming towards the percussion, that is, whether it is dull or resonant, the latter indicate an air-filled lump. Then auscultation is done, that is bruhi or bowel sounds. Finish your examination, cover the area and pay thanks to the patient. Okay, now points which are specific for certain swellings. We will discuss these, and the description of the your case, how you will present your case, the description of the dermoid cyst specifically. These are the most important cysts that present in the patient. So we will discuss the description for the dermoid cyst specifically. Okay, so the points which are specific for central swellings, that is lipoma. The lipoma slip sign is specific for lipoma. It may have smooth or lobulated surface. They may be transluminant. After doing the examination, the examiner may ask that what are your differential diagnoses, or what is this type of swellings. So it may be a lipoma. If it is a lipoma, then it may have smooth or lobulated surfaces and they may be transluminant, and the slip sign is specific for lipoma. This is the diagnostic point. Now for sebaceous cyst, it occur very hairy area of the body. Okay, sebaceous cysts occur over the hairy area of the body, and all sebaceous cysts are attached with the skin, or skin cannot be pinched or swelling. A punctum is present at the apex of a cyst in 50% of the cases, and punctum represents the opening of the sebaceous glands. Sebaceous cysts are not found on palms and soles, as there are no sebaceous glands over there. So this is the diagnostic point, that the places where in the body which are hairy, the sebaceous cysts are present there because there are sebaceous glands, and nowhere are sebaceous glands. Okay, now dermoid cyst. The congenital dermate cyst occurs at any point in midline of the trunk and they are fluctuant but do not transilluminate. As compared to sebaceous cyst, it has no punctum and skin or it is pinchable. Now ganglion, it is the most commonly found on dorsum of hand and wrist and becomes fixed on contracting the tendons. Neurofibroma is usually multiple and they are more mobile at the right angle, transverse axis to the nerve to which they are connected, and less mobile in longitudinal axis. So this is the diagnostic point about neurofibroma, that they are multiple and they are mobile at right angle. Ganglion are most commonly found on dorsum of the hand and wrist and becomes fixed on contracting the tendons. Dermate cysts are congenital and occurs at any point of the midline of the trunk and they are fluctuant but do not transluminate. So these are the diagnostic point about the specific lumps or swelling. These are the some types, that is lipoma, sebaceous cyst, dermate cyst, ganglion, neurofibroma. So if there is a swelling over the if a examiner asks you to examine the swelling and then he asks the differential diagnosis, so you may answer them as this may be a sebaceous cyst, a dermate cyst, a lipoma, a neurofibroma, and a ganglion. These are 5 differential diagnoses of a swelling. What are the 5 differentials? Lipoma, sebaceous cyst, dermate cyst, ganglion, and neurofibroma. These are the 5 differential diagnoses of the swelling or lump. Okay, now how you will represent your case, or what is the description? You will represent it as follow. This young lady has presented with 2 into 2 centimeter panelless spherical non-tender non-pulsatile solitary swelling on the flexor surface of her right forearm, which is 5 centimeter proximal to the wrist joint. Overlying and surrounding skin is normal. There is no scar, no prominent veins or pulsations over it. The temperature over it is comparable with the surrounding skin and it is non-tender. It is 2 into 2 centimeter hemispherical lump with lobulated surface, soft consistency, and slippery margins, slip sign. It is fluctuant. The slippery margins are only present in the lipoma. Okay, it is fluctuant, non-transluminable, non-compressible, and non-reducible. It is freely mobile in all directions. Okay, so it is freely mobile in all directions and skin over it is pinchable and it becomes more prominent on contracting the flexor muscles of the forearm. Draining lymph nodes are not palpable and neurovascular status of the limb is intact. The description of dermate cyst. This young patient man presented with single panelless lump on the posterior aspect of his right ear for 5 years. Overlying and surrounding skin is not discolored and there is no scar mark, no prominent veins, no pulsations and no puncture. The lump is non-tender and temperature over it is comparable with the surrounding skin. It is about 5 into 3 centimeter ovoid shape mobile lump with smooth surface, well-defined margins and soft pitting consistency. It is fluctuant, identable, non-transluminable, non-compressible and non-reducible. Overlying skin is pinchable and it is mobile over the deeper structure. It has dull percussion node and no bruit audible over it. The cervical lymph nodes are not enlarged and EAT examination is unremarkable. So this was all about the case representation of a normal swelling. Now coming towards the next examination, that is examination of the breast. We will discuss this in the next video. Thanks for watching.